Thank you, Mr. Acting President. I'm shocked and appalled that we're even having to have this conversation. I'm shocked and appalled that our rights are here on the table. I'm shocked and appalled that our right to make this decision, with all the options available to us, is being considered. The right to make this decision without stigma and abuse, without shame and trauma. The right to make this decision on our own terms, with our health professionals. And today, voices will be debating our bodies who will never find their body in this situation. I would much rather be here talking about safe and equitable access to abortion, but instead I'm having to defend fundamental healthcare. It's no surprise to anyone that the Greens are not supporting this bill today. As a side note, I heard the Premier on the radio this morning claiming that the Greens have a hard line on every issue and don't ever take a conscience vote. Well, if the Premier actually understood how our party works on grassroots democracy, he would understand that we have a right to vote differently from each other on every bill. But there are mechanisms in place for us to report back to our grassroots members why we've made the decision we have. For the Greens, this is an endorsed policy of our party that abortion care is health care. This is a policy position that is democratically decided by the members of our party, endorsed by all the delegates from all the branches and supported by our MPs. We have always supported the right to an affordable, equitable and safe access to abortion, and that commitment continues today. The same cannot be said for the Labor or the Liberal Party. Every time there's a debate about our bodies or the rights of the queer community, the Labor and Liberal parties make this a conscience vote. Why is that a problem? Well, at election time, when people vote for these parties, no one can know how their party will then vote on issues that impact all of us. Independent research from the Australia Institute shows that 68% of Labor voters, 58% of Liberal voters and 50% of One Nation voters support access to abortion outright, not just in limited circumstances. One Nation has been very clear that they do not support later stage abortions, regardless of what the voters want. As for Labor, when you vote for a party, you should be clear on what you're going to get. And I would wager that the 68% of Labor voters who support abortion outright would be upset to know that their vote has gone to a party who has members that will vote to limit abortion access here today. The Greens have consistently called on the Labor Party to take a policy position on this issue. And if we hear any complaints from Labor that this might pass the upper house, it's on them. If Labor want to claim that they stand for women's rights, then they need to stand for them. Actions speak louder than words, Mr. Acting President, and Labor's actions on this issue need to reflect the modern state that they seem to represent. I'm proud to be part of a party that sees abortion as a choice between a person and their healthcare professionals. There is serious opposition to this bill in the healthcare sector, as outlined by the Honourable Mira Eldenawi. This bill is opposed by the Royal Australian and New Zealand College of Obstetricians and Gynaecologists, the Royal Australian College of GPs, the Australian College of Midwives, and Shine SA. It's further opposed by advocacy bodies in other sectors, including the Women's Lawyers Association of South Australia, the Working Women's Centre, and SA unions. My office, over the last few weeks, as many other members will have also, received over 1,800 emails that ask us to oppose this bill. Only 60 asking us to support this bill. I asked the community what they wanted to say in this place if they had a voice about this bill, and here are their reflections. Abortion is a fundamental women's right, and choice should be left to the mother. Parliamentarians should address real problems such as domestic violence instead of wasting time. Hands off our bodies. Taking away abortion access doesn't mean it stops abortion, just makes it unsafe. Would love to know why this is being debated a third time in less than 2 years. This isn't just going to affect women who want abortions, but also women who desperately want their bodies, want their babies, but have medical issues or miscarriages. Every time it's brought up in public discourse, it's re-traumatising for those of us who have had miscarriages or abortions. Fatal fetal abnormalities are traumatic for the fetus, the families and the medical staff. Nothing but grief comes from these terminations, but they are necessary. They are all comments from our community directly to us, asking us to oppose this bill. The evidence is clear that the voters, the health sector, the advocacy organisations and the South Australian community do not want us to pass this bill. 1% of all South Australian abortions are performed after 23 weeks, and the current legislation has existing requirements for a person seeking abortion after this time. 2 doctors are required to approve abortion after 23 weeks, and they must consider the pregnant person's physical and mental health and any fetal abnormalities. This is a deeply personal choice, and instead of caring for people at this time and allowing them to come to an informed decision, this bill takes their options away. As stated by the Royal Australian and New Zealand College of Obstetricians and Gynecologists, and I quote, "Restrictive legislation does not improve patient care outcomes and may instead cause increased distress, delay access to treatment, and compromise the ability of clinicians to provide appropriate patient-centred care." There are many reasons why someone might be in a position to consider abortion after 24 weeks. The person might have a terminal illness diagnosis or be subject to coercive control where the pregnancy is being used to keep her in a violent situation. The Honourable Sarah Game in her speech talked about numbers of abortions, but I ask her, has she investigated the issues that each of these people faced when making the decision to have an abortion after 24 weeks? Has she considered what is going on in their lives at that time? It isn't as simple as whether we can save a life. We never fully know someone's circumstances, and they are often complicated and multifaceted. Yesterday, a number of us were invited to a briefing hosted by the Honourable Mira El-Danawi. And at that briefing, we heard from healthcare professionals and people across the sector advocating for full, safe and affordable access to abortion care. One of the things that really struck me, and I think I learned from, was the case of children who are the victims of incest, child abuse and rape, and how this bill would force those children to carry a pregnancy to term. The proponents of this bill talk about this in terms of care for children. How can we say we're caring for children? We are forcing those children to carry these babies to term. Situations are so personal, individual and complex. Families should have all options before them, instead of the trauma of having politicians take away one of their options. One highly personal story has appeared in 2 articles, one in the Sydney Morning Herald and another in Mamamia by Toby's mum, and I would encourage all members to read this story. Toby was her 2nd child, and she was 35 weeks pregnant when she found out he had suffered a brain hemorrhage around 29 weeks. He would never walk, talk or live independently. He would be quadriplegic, blind and cognitively impaired. When he was born, he would need several surgeries, including removing fluid from around his brain. She describes the hard decision she had to make, either end his life and reduce his eventual suffering, or give birth to him and prolong his life as long as possible. She chose to deliver him stillborn. She was given a choice that was not about her own suffering, but about how she could limit the harm to Toby. She loved him, and she made a decision as a mother to take the kindest choice she had available to her. I would never want to diminish her experience, nor her right to make the best choice she could as a mother and the person carrying the baby. Bills like this and their proponents inside and outside this chamber limit our ability to have nuanced conversations about what is and isn't working in abortion care. I have heard from several midwives that there are ways we could be improving outcomes at late stages of pregnancy, but instead of having that good discourse, we're having a culture war about the right to choose. Perhaps instead of consistently bringing bills as a political game of who is and isn't pro-choice, we could be working together to improve health outcomes, improve healthcare, especially in regional areas. Instead of people grandstanding and trolling on social media and calling those of us who support abortions baby killers, I urge people to have care and compassion for those who make this choice. I have never gone after people who have different views from mine, even when they've called me a barbaric monster. I don't engage in that kind of discussion because this debate isn't about us versus them. This debate is about how we give people the most autonomy when they are making a decision with their healthcare team. This debate is about consent and the freedom to make a choice. This debate isn't about us as politicians and which side we stand on. This debate is about what's happening in the real world to real people. It's not our choice to make. We don't have all the facts about everybody's individual circumstances. This is only a choice that can be made at an individual level. To any members considering supporting this bill, I encourage you to ask yourselves if the care and compassion you believe you have extends to the people who make these personal decisions. Do you care about them and their ability to make a decision with their healthcare professionals? If you don't trust the healthcare professionals or the medical information that's given to people, let's talk about how we can give people the most informed information, not just outright limit choices. I urge all members to talk to people who've had these experiences and had to make these decisions. I urge all members not just to look at numbers on a piece of paper, but instead see the human stories behind these choices.